Hello, my name is Dr. Scott Osting. I'm a specialist in hospital medicine here at Hendricks Regional Health, and I've been working in your community for 5 years. I'm here to educate you on 2 monoclonal antibody treatments that are currently approved for the treatment of early COVID-19 virus. Right now, there are 2 treatments available, bamlanivimab and the combination drug casirivimab and divimumab. These treatments have similar effectiveness and side effects, so for the remainder of this video, the term monoclonal antibodies will be used to make the video easier to understand. Information in this video is provided in writing in the consent for treatment and the fact sheet you will be provided before administration. You will have time to read these prior to your administration. You will also have the opportunity to ask questions of a Hendricks Regional Health associate. This video was prepared December 21st, 2020. During this volatile time, the information is subject to change. Please visit the websites of the FDA and the drug companies for the latest up-to-date information. Eli Lilly provides bamlanivimab and Regeneron provides casirivimab and divimumab. How do antibodies work? Antibodies are a vital part of our immune system. They tag foreign material in our body for removal, then other parts of our immune system clean up the tagged material. When your body finds a new infection, it takes time to make antibodies. The body must first set up factories, and that takes between 1 to 3 weeks. You may not have detectable antibodies in your blood for 3 weeks. Although antibodies start working after the first 7 to 10 days of infection, the body makes only small amounts until all the factories are set up. What are monoclonal antibodies? The coronavirus has a spiky shell. You typically will make antibodies to the spike portion, but not in big amounts until 1 to 3 weeks after your infection. Monoclonal antibodies are simply those antibodies to the spike, but made in a lab. They are best given as early in the infection as possible and are not helpful after 10 days based on early studies of COVID-19. How do monoclonal antibodies differ from vaccines? Vaccines are another important tool in fighting infection. They convince your body to make antibodies against the infection. These will not be fully ready to fight infection for 1 to 3 weeks, or if you need a booster dose, up to months. Monoclonal antibodies are different in that you get the power of antibodies the same day of your infusion. These monoclonal antibodies will be cleared by your system in the following weeks. What does Federal Emergency Use Authorization mean? Federal Emergency Use Authorization is a term associated with a treatment where the FDA authorizes use of an unapproved product during a state of emergency. Typically, the FDA requires stringent safety studies among large groups of people to make it easier for doctors and patients to know the risks and benefits of treatment. In this case, the FDA decided based on early data that monoclonal antibody treatments appear to be effective enough with low enough risk to treat patients at high risk for significant consequences from COVID-19. However, they will not put their seal of approval on these treatments until they are better studied. Who qualifies for monoclonal antibody therapy? Right now, these treatments are reserved for those patients who are more likely to become seriously ill with the virus. The first group are patients 12 to 17 years of age and at least 88 pounds with symptoms of coronavirus and one of these health issues. Secondly, patients 18 years old with symptomatic coronavirus and one of these medical issues. Thirdly, patients greater than 55 years old with symptomatic coronavirus and one of these conditions. Lastly, all patients over 65 years old with symptoms of coronavirus qualify. You will not qualify for this treatment if you are already hospitalized. Also, you won't qualify if you're requiring more oxygen than normal. You cannot have had COVID symptoms for more than 10 days. And it is most effective as early as possible in your course. How do I receive this treatment? You'll be given one of the treatments based on availability. These are in short supply, so you will not be able to choose which one to take. There are not enough doses of this medicine at this time to be given to all patients that qualify. An IV will be placed and the infusion will occur over an hour. You must be watched for an hour after the infusion as well. You will have time to ask questions prior to administration. Make sure to mention if you have any allergies. Tell your team about the medications you take, or better yet, come with a list. You may decide to not get the drug after arrival for your appointment and may stop it at any time. Your medical team may stop the infusion due to symptoms, and you may not receive the full dose if this happens. What benefits do I expect to receive from monoclonal antibodies? COVID-19 illness may range from mild to severe. Death, worsening of other medical conditions, and new long-lasting medical conditions like heart disease, lung disease, neurologic compromise, weakness, and diabetes can occur and may last for a lifetime. 2 trials showed that in patients at high risk for disease progression, 3% of those treated with monoclonal antibodies were hospitalized versus 9 to 10% of those receiving placebo infusions. Both monoclonal antibody treatments were shown to decrease emergency department visits and decrease the amount of virus in a patient's blood when compared to the placebo group. What alternatives do I have? Currently, in December 2020, there are limited treatments available to those that are at high risk of disease progression. There may be other treatments allowed under federal emergency use authorization for COVID-19. Go to www.covid19treatmentguidelines.nih.gov for information on other medicines used to treat people with COVID-19. What are the risks of this treatment? Any medicine administered through a vein may cause symptoms that may include brief pain, bleeding, bruising, soreness, swelling, and possible infection at the infusion site. Allergic reactions may be present as fever, chills, low blood pressure, changes in your heartbeat, shortness of breath, wheezing, swelling of your lips, face or throat, rash, including hives, itching, headache, nausea, vomiting, sweating, muscle aches, dizziness, and shivering. Tell a team member immediately if you notice any of these during administration, and seek medical attention for these symptoms immediately if you have left the infusion area. You may feel unwell after the infusion, and it may be difficult for your provider to differentiate these symptoms from symptoms of COVID-19. These are not all the possible side effects. Serious and unexpected side effects may occur. Specific studies have not been conducted to address these possible risks. It is unknown if infusion of this treatment may blunt your typical production of antibodies, leaving you open to being infected again. It is unknown how this treatment will affect your ability to receive a COVID-19 vaccine, or if it will lead to increased issues with other monoclonal medicine treatments you may receive in the future. What to do if you have concern after treatment? If you're having an emergency, call 911 immediately. You may also speak to your primary care office. Side effects should be reported to FDA MedWatch at www.fda.gov/MedWatch. Please note which monoclonal antibody you have received in your own records. Thank you for joining me for this important discussion.